and welcome to today's episode. I'm your host Richa, and joining us today Dr. A.K. Dhar, an experienced oncologist. Doctor, welcome. Today we're gonna put an insights on lymphoma cancer. Doctor, would you like to share what is lymphoma cancer and what are its causes?
Yeah, thank you, Richa. Let me explain what is lymphoma. Lymphoma is basically cancer of lymph gland. And they are usually found in neck, in armpit, in abdomen, and in the inguinal areas. And when this cancer happens, these glands, they get enlarged. The patient starts running fever, he loses weight, and his appetite becomes dull. So these are the patients who should be recognized early and treated properly.
What are the different types of lymphoma cancer, doctor?
There are various types of lymphomas, if I am not exaggerating. But broadly speaking, and for the sake of my audience, I will say that lymphoma broadly can be classified into two groups. One is non-Hodgkin's lymphoma and second is Hodgkin's lymphoma.
So how do we diagnose? What is the right diagnosis for it?
Yeah, lymphoma is diagnosed by doing a biopsy.
Biopsy.
Biopsy of the lymph node, that is number one. And second, if biopsy of the lymph node is not possible, then the bone marrow examination should be done.
Okay.
And the bone marrow examination includes bone marrow aspiration and biopsy.
Sure. And what is the right way of getting it treated?
See, right way these days, a lot of new treatments have come. And let me tell you, my audience, that majorities of lymphomas, they are treatable. About 80 to 90% lymphomas can be treated. And they are usually treated with immunotherapy, targeted therapy, chemotherapy, and supportive care.
Sure, great to know that. And now I come to my favorite topic, I want to listen to a story or a case you would remember and would like to share with the audience to create the awareness.
I had a very peculiar case about 2 years back in Gurgaon itself. I was called to see a patient in intensive care unit, and I was told by the relations that he was running fever for last 4 or 5 days and was being treated for malaria. In the night, he fell down and became unconscious. And when he was brought to the hospital, he was bleeding from the nose, he was bleeding from the mouth. And when I examined the patient, I found that he was in coma. The ICU team had done some investigations and they were horrified to see some abnormal cancer cells in the blood. When we examined him, we found that his spleen was ruptured. There's an organ, spleen, jisko Hindi mein tilli bolte hain. The spleen was ruptured. So I requested the surgeon to operate the patient because ruptured spleen has to be taken out. And immediately after surgery, I told the patient's attendant that, see, it's an emergency and we have to treat him. He has got lymphoma. The attendants were scared. They said, we will not get him treated because we have heard that if you treat lymphoma, lymphoma will get worse. So this is one of the myths which my audience should know, that lymphoma, when treated, gets better rather than getting worse. So I started treating him. He became conscious. He became all right. His wound healed. And after 2 years of treatment, he is disease-free. So it's very astonishing to see that the patient had lymphoma. Because of the lymphoma, his spleen had enlarged. And because of the large spleen, with little bit of impact, that is impact of falling down, his spleen ruptured, which is a dangerous condition. But luckily, we were able to save him.
That's great. That's great. Great to know that. Thank you so much, doctor, for sharing your experience and expertise with us. And, I hope if you found this helpful, do share among your family and friends and create the awareness. Let's fight cancer together. Thank you very much for joining us today. Thanks.
Thank you,
doctor.
Thank you. Thank you very much.